Hi, good evening everybody. Today I'm doing an informative speech for you guys, and I've created a slideshow PowerPoint so that you guys can get all that information. It's going to be about TMJ and the teeth. I feel like this is an extremely important topic and it's going to give you guys a lot of information. So my name is Melissa and I will be presenting this slideshow to you guys. Thank you guys very much. I'm actually excited. I've had a wonderful opportunity to work in a dental office for 18 years. And so every day this dentist was an amazing teacher, and he would come and talk to me and talk to the patients and teach, and he would teach us every day. So we were able to find out new information, and he was very innovative. He had a lot of technology, and it's just super special to my heart, but it's going to give you guys that information so that if ever this topic comes up for anybody, as far as like a friend might have this issue or a parent, a loved one, something like that, you can have kind of some advice or where to go to if you guys have somebody that presents with these types of symptoms. And so today we're talking about TMJ and the teeth. And so pretty much a lot of people don't know what TMJ is. And so everybody has two TMJs, okay? It's the temporal joint, mandibular, jaw joint. We use it every day, right? We eat, we chew, and that's how we function. We talk with it. And so basically we have a right jaw and a left jaw, and if they're not working properly or in the correct position, then they will start to click and pop, and over time can cause ear pain, jaw pain, neck pain, and a lot of underlying issues and health issues. So I'm going to go over this PowerPoint. Everyone has two TMJs. So it means temporal mandible joint. The right and the left joints should work in sync with each other when opening and closing. But if there is any interferences or protruding areas in the bite when chewing, most people will get clicking and popping noise. Many people go untreated until they break a tooth or they get lots of swelling in their jaw, and it's kind of, you won't be able to, or you get ear pain. So a lot of people won't go until they get the symptoms. And so by that time, there's going to be some treatment necessary. And so in this lecture, you're going to learn about symptoms, you're going to learn about treatments, and what TMJ disorder is and what can be done to prevent it, and in short-term and long-term maintenancing of it, okay? So the next slide I'm going to have is who's affected by TMJ, because a lot of people think that it's only certain people, like certain age groups, things like that. And so in an article that I read by Dr. Okerson, he talks about the different ranges of age groups, but it also affects women. Mostly are going to be more prone to it. They have TMJ issues because our ligaments are a little more flexible than men. So men have the powerhouse clenching in their jaw, and women have the ligaments and the elasticity that we have for having kids, so our ligaments are more flexible. Growing teens who are growing in a malocclusion, a lot of them have grown up where they've either been sucking their thumb or they have a vaulted palate. And so I put on here young children with facial deformities, a high vaulted palate, growth asymmetries, trauma to the face. So those are some of the people who are affected. So symptoms, which people don't know, all of these that could be causing some pain. So jaw pain, tightness, cramping in your muscle, which is the deep masseter muscle, the clenching feeling, ear pain, ringing is associated with this disorder as well. Headaches, migraines, clenching of the teeth, again, grinding, neck and shoulder pain, teeth sensitivity, cracked teeth, and chipped teeth. And then also dizziness, because when the equilibrium is off, then your jaw joints and everything else can be off too. And so those are some of the symptoms that people might present with that. And some of the treatments are night guards. I have some specialty information from Dr. Supple's office from www.digitalocclusion.com. And what he does is he basically will align the bite and the bite splint. So that way your jaw joint's kind of like one leg shorter than the other. He makes the bite splint to correct that. And so over time, your bones will build up scar tissue, and then you'll be able to function correctly because you're going to build up scar tissue. Your eating and chewing will be more symmetrical. And then he also talks about biofeedback in his lecturing and stretching. So being aware of our postural patterns is super important, because anytime that this is hunching over, then you're going to tend to clench down, neck will be tight, and it just leads to lots of issues. And then we also have the bite occlusion adjustments, which is balancing and shaping the teeth, so that way when you eat and chew, it's not like you're stepping in. Like, a lot of people don't realize this, but they have that sensation of, have you ever had like a rock in your shoe? And you try to walk every day and you're just like, that wouldn't work, right? And so when you have a bite that's off balance, it's like having a rock in your shoe. And simply by reshaping it, you can actually get, you know, some balance in your bite and your teeth. Medications, some people try to gear away from that because they can be addicting and it's kind of a form to treat it, but pain medications, muscle relaxers, things like that. Icing the jaw for 5 minutes on and off actually is one of the key things, because it's ligaments, and so like if you get a sprained ankle, same thing. You're gonna get some spraining in your jaw. Say you eat a tough steak or a bagel, anything like that. You wake up with your jaw sore, you're gonna wanna ice it, and that'll relieve some of those symptoms. Heat and massage always helps with the neck and shoulders as well. So a lot of people wanna know what's being done about these disorders. And so the American Family Physician talks about all of the ear pain and the headaches, things that are caused by this disorder. And the National Library of Medicine also states about a bunch of treatments. But one of the main goals is the International Journal of Dentistry did studies. And they did studies on all of these different things that are causing it and how we can help people and be preventative. So dentists and physicians are joining together. Can you zoom on right here so you can get all this information from me? Thank you. Dentists and physicians are joining together to be proactive. It is said that there are dentists who are the future oral and physicians for health. So most dentists see young children at a young age when they're healthy. They don't go to the dentist when they're feeling sick. And so the dentists are able to look and pinpoint all of the issues that they're having with their tonsils, adenoids, breathing disorders, and kind of go into that small scope of practice and showing that they can refer out to ear, nose, and throat specialists and prevent their palates from growing in a vaulted pattern. And so when the bite is misaligned, the hinges, which are the jaw joints, it can become like a downward spiral. And as parents, we can use early intervention methods by also recognizing those patterns in our children. Some of the key patterns can be sleep, allergies, chronic pneumonia, chronic ear infections, ADHD, and they're all signs of TMJ disorders. So in many cases, we can adapt. And so it's not really a reason to freak out, but when you start to get into those phases where you're in pain almost every time you eat and chew, then you need to be proactive. See a dentist, see your physician, and pay more attention to all of these vital signs and symptoms that can be causing an underlying issue for, many decades. And so basically that's the end of my PowerPoint, and I hope that you guys got a lot of information from that, and I appreciate you all. Thank you for joining me on this journey.
Thank you.